This is Dr. Tori with RookieDoctor.com. It's time for another one of those quick tips where we go over some quick pearls that you can use for your clinical years of medical school, your internship, and your residency. And in this one, we're going to go over the timing of seeing patients. In the last one, we mentioned that the ones you see first are the most critical patients, but this one might seem a little surprising, and for some reason, a lot of people screw this up. I don't get why, but here it goes. After seeing the critical patients, see the ones that are going home next. Okay? After seeing the patients that are critically ill or that need quick, somewhat rapid medical attention, then you take care of the ones that are being discharged. There are several reasons for this. The first is that the patient satisfaction. Okay, when patients think they're going home, and you round at 7 in the morning, maybe earlier than that, maybe a little bit later than that, and you tell the patient you're going to be going home today, they want to get out. Okay, most of them. Most of them. So they want to get out. They don't want to wait around all day for you to, finish rounds, go to your conference, eat your lunch, come back, write the orders. Then the nurse has to take time to go over the orders with the patient, etc. And by the time they're leaving, it's 3, 4 o'clock. So A, patient satisfaction. That's one of the reasons. B, another reason is that you're holding up a bed, which means that if there are other parts of the hospital, like the emergency room, like lower levels of care that require a patient to be transferred to where your patient is being discharged from, you're clogging the system up, and you're causing pain for a lot of people in the hospital. The nurses, the emergency room, the ambulance drivers, the potentially even affecting the medical care of other patients that aren't yours. So you need to get these patients out. When people are telling you got to move them, they're not telling you got to move them because there's some hard-hearted, it's all about money kind of thing. No, they need to, wherever there is a flow and something is stopping that flow, it needs to be addressed. And so after seeing the critical patients, you see the ones going home next. Now, so that was A and B. Now C. Another reason is that it's going to eliminate a lot of the calls you get. You're going to get calls from the nurses about the patient that wants to go home. And, so the quicker you address it and the quicker you get them home, the fewer calls you'll get. Okay? So, very simple. After the critical patients, see the ones that are going home next. It helps everybody. Okay? Now, if you thought that tip was helpful, again, there is my #1 tip for internship and residency is at internship-tips.com. Internship-tips.com. And you can see more stuff like this on the rookiedoctor.net blog. Okay? Check it out.